you want to hear from those people who would normally not get their voices heard on an international news channel. One moment I'll be very proud of was when we covered the Nepal earthquake of 2015, a terrible natural disaster and a story that needed to be told from the heart of the affected area. To be there and to tell the people's story was very important at the time.
The world economy is headed for a recession. China won't be there to save it this time. Northern Ireland's health service at breaking point. South Korea set for one of the worst growth periods in half a century. The richest person in the world just gave $98.5 million to help the homeless. Why am I reading these headlines to you? Well, it's to prove a point. These could all have easily been post-pandemic 2020 headlines. In reality, though, they were all published in November 2019, a month before COVID-19 had even been heard of. Because well before the coronavirus pandemic hit, much of the world was already deep in a crisis of capitalism. And now, with millions out of work, entire industries utterly stagnant, and healthcare systems scrambling for a vaccine, the question is, did capitalism turn the COVID emergency into a disaster? Capitalism. It's an ideology, an economic system, a political statement. But how is a system based on private ownership and the pursuit of profit serve the world in a time of crisis, when the situation demands we act not for individual gain, but collective benefit?
Stay at home and protect lives.
They've said test, test, test.
Without preventive measures, there could be a spike in cases.
All these cancellations are a way to flatten the curve.
COVID-19 hasn't been like any other crisis. Job losses, healthcare struggles, a critical need for relief from the state have all struck segments of society that normally don't face these kinds of grave economic stresses. In short, all of a sudden through this pandemic, this once-in-a-century type of crisis, it's become evident to many that pre-COVID times were also a crisis of sorts. As entire countries went under lockdown earlier this year, I spoke with a group of people whose work has been all about dissecting and analysing capitalism.
When people say they want to go back to normal, who can blame them? Because that sounds pretty good to me right now as well. But the thing about normality, as we think about it in terms of economics and politics, was it was actually pretty sick. A lot of the people right at the top of our society did pretty well out of that normality, even if it meant other people didn't have a proper roof over their heads, even if it meant there wasn't enough food on the table to feed the parents and the kids got to eat but the mum went hungry. That was the kind of society that we lived in, and I'm talking to you from one of the richest societies in human history, and yet we didn't have the money to do that.
In my opinion, capitalism is the pandemic. That is the root cause of so much of the suffering we're experiencing now. I mean, I want things to go back to normal. I want to be able to go to a cafe. I want to be able to see my friends. But I don't want things to go back to the normal that we've been living with for the last 40 years of wealth concentration, of exploitation of working people. That's the paradigm. That's the context that set the stage for our current calamity.
This virus has intensified a spotlight on healthcare, what it costs, who gets access, and its ability to respond in a crisis. One system that runs shockingly counter to the needs of so many it's supposed to serve is the one in the United States. American healthcare is largely privatised and lacks pricing regulation, both key traits of a capitalist system. This means not only is every element of the healthcare system, from hospitals to drug manufacturers, owned and operated by the private sector, but those businesses are free to charge whatever they like. This makes staying healthy in the United States a scarily expensive proposition. There's a small percentage of the population, about 18%, that does get some state support for medical costs. But for the vast majority, private health insurance is the only recourse. They charge notoriously expensive premiums, making them unaffordable for many, and are filled with loopholes and gaps that mean even insured Americans can be left with hefty medical bills to pay. That's why before the pandemic, it was estimated that 87 million Americans were uninsured or underinsured, and medical bills were a leading cause of personal bankruptcy.
You know, in the United States, People can't access healthcare because they can't afford health insurance. Even if they have insurance, they are buried in debt after the fact. What happens when something like the coronavirus hits a population that's indebted, you're devastating a population that has no savings, right? 40% of Americans before the crisis were reported to not be able to handle a $400 emergency.
America's healthcare crisis has intensified during the pandemic. A tidal wave of layoffs have meant that as many as 27 million Americans have lost employer-provided health insurance. And without that cover, a hospital stay to treat COVID could cost as much as $73,000. This is despite a government plan announced in March to cover some COVID-related medical bills. The lack of coordination and the need for medical suppliers to keep turning a profit has led hospitals into bidding wars over crucial supplies like PPE masks, tests, and medical equipment.
Doctors and nurses warning that critical protective gear is running low.
This is a hospital where the healthcare workers have taken to wearing garbage bags.
It's like being on eBay with 50 other states bidding on a ventilator.
The hospitals are run for profit, and so they don't have adequate staff, right? Because that would eat into revenue. They don't want to have extra medical supplies just languishing, not being used. So what we're going to see is a lot of people who are going to perish, not because of the virus per se, but because of the lack of access to adequate healthcare, the lack of access to protective gear. We're going to see people who don't seek treatment because they're afraid of not being able to pay for it. It's already been reported by emergency room doctors that, people, their last words are literally, but who's going to pay for this?
Coronaviruses aren't new. They've existed in humans since the 1960s, and they cause a range of different illnesses, from the common cold to more lethal varieties such as the outbreak of SARS in 2002 and MERS in 2012. In 2015, the World Health Organization even listed coronaviruses as being among the top possible causes of a major epidemic. So how is it that pharmaceutical companies have been caught so off guard by this virus?
In May this year, Brussels-based research centre, the Corporate Europe Observatory, published a detailed investigation into the effectiveness of the Innovation Medicines Initiative, IMI. It's the world's biggest public-private partnership in life sciences, and it directs billions of dollars worth of funds to biomedical research at the world's biggest pharma companies. What the investigation uncovered was that not only did firms in 2017 turn down an EU proposal to work on vaccines for pathogens like coronavirus, but €2.6 billion of IMI's funds were transferred into projects that represented much more commercially profitable avenues for the pharmaceutical industry. This investigation reinforced a point that big pharma insiders and whistleblowers have been making for a while, that serious matters like pandemic preparedness are being held hostage by commercial considerations. On March 5th, as coronavirus cases spread across the US, a congressional hearing was taking place.
We also took on a decade ago the interesting problem of making coronavirus vaccines, because we recognize these as enormous public health threats, and yet we have not seen the big pharma guys and the biotechs rushing into this space. So,
Dr. Peter Hotez, one of America's leading vaccine scientists, said that a vaccine his team had created 4 years ago in response to the SARS outbreak may have been able to provide patients with cross-protection from the virus at the heart of this pandemic, but it simply hadn't been commercially enticing enough for drug companies to invest in.
The bottom line is, had we had those investments early on to carry this all the way through clinical trials years ago, we could have had a vaccine ready to go.
One of the big problems with capitalism is that capitalists direct investment. So capitalists say, what's really important? Viagra, because that's a huge market. Even though the coronavirus exists, let's not invest in a vaccine because that market doesn't really exist. And also, do we really want to vaccinate the whole world in this preemptive measure? No, let's create something that we can sell now. So, we let capitalists direct investment at our collective peril.
Whenever a vaccine is hopefully created, the next battle, at least for patients in the United States, will be over affordability. And that's when we're back to one of the fundamental potholes of the American healthcare system, where unlike in almost every other nation, basic pricing controls simply don't exist. And it's not even as though this is a secret.
And you're saying it will for sure be affordable for anyone who needs it.
I'm saying we would want to ensure that we work to make it affordable, but we can't control that price because we need the private sector to invest.
That was Donald Trump's Health and Human Services Secretary, Alex Azar, at a congressional hearing in February this year. An interesting side note, before he was appointed to his role in government, Azar worked as the top lobbyist for the pharmaceutical firm Eli Lilly and Company.
The hunt for a coronavirus vaccine has now suddenly become one of the most well-funded areas of biomedical research. Not only are governments and pharmaceutical giants investing in it, the so-called superheroes of the corporate world have all stepped into the fray.
The CEO of Netflix is donating $30 million toward research for a coronavirus vaccine.
Microsoft co-founder Bill Gates has continued the fight against coronavirus, investing billions of dollars on the construction of factories working to develop a COVID-19 vaccine.
Some of the wealthiest people on Earth, founders and CEOs of mega corporations, are making headlines for donating to COVID causes through their own philanthropic organisations. But it's not just about the money. It's the perception that it comes with all the trappings of the corporate world: efficiency, returns on investment, streamlining of operations. All of this has transformed what was once simply charitable giving into something else: philanthrocapitalism. Lindsay McGooey has written about it extensively in her book No Such Thing as a Free Gift.
I think we have to move past the headlines sometimes. Mr. Gates did talk about the need for mass testing at an earlier stage than some US officials, and that was a good scientific approach to take. But I really do question whether or not their efforts were anything more than a Band-Aid solution, because there was no evidence that they were really having much of a positive effect on the sort of really deteriorated and ramshackle approach that was underway in the US more generally.
I think what we're applauding when we see a billionaire dipping into their own trouser pockets and handing over some cash is we're applauding the myth that capitalism works for everyone, that anyone could be that billionaire and be the ordinary guy who hands across the money. And that's not the case. Their billions are a collective creation, not their own individual creation. Every billionaire is a sign of capitalism's failure, because no one should have that amount of money when other people are sleeping on the streets or going without food.
Inequality is one of the defining factors of capitalism. It's meant that the world's top 1% now hold close to 50% of global wealth. And so when the philanthropists among them contribute to causes, it's often only a mere sliver of their net worth. Jeff Bezos's $100 million donation to US food banks, for example, amounted to 0.07% of his estimated wealth. Mark Zuckerberg's $25 million donation, again, just 0.05% of his net worth.
The point of all these numbers isn't that billionaires should be giving more. That's another discussion entirely. No, the point here is that philanthrocapitalism is too often used as a distraction from more meaningful, possibly more expensive, systemic changes. Rampant corporate tax avoidance, the suppression of minimum wage levels, reliance on state subsidies, precarious working conditions. I mean, the list of what actually needs to be addressed is long, and it can often get obscured by flashy headlines or news segments about billionaires and their generosity.
You two stepped up, and you're providing $25 million. We didn't have the money to do that, and I just want to thank you too.
This is not an accident, right? I mean, this is the product of a political strategy that's been going on for the last 40, 50 years, whereby taxes are slashed and private wealth accumulates. And what that private wealth does is it concentrates power, and that threatens democracy. So we have this really negative feedback loop where the more dysfunctional the state is, right, the less it's able to provide basic services, the less it's able to protect our public health, the more ammo there is for the corporate sector to say, hey, look, the state is inefficient, the state is incompetent. We, with all of our resources, can save the day.
That big philanthropic power to influence is a point that's not lost on billionaires like Bill Gates. When asked in 2012 if he would ever run for president of the US, he responded,
I actually think, maybe I'm wrong, that I can have as much impact in that role as I could in any political role. My role in the foundation, I don't have to raise political campaigns. I don't have to try and get elected. I'm not term limited to 8 years. It's a very nice office.
I don't doubt Bill Gates' motives for being involved in this are very sincere. He's got a long history of being involved in these things, but he's not beholden to any voters. He can make his own decisions. It's his money to do with as he wishes. And so it's not going to be democratic what he does. That's not the constraint he works under. So what he does effectively is not a replacement for the government.
In a complex world looking for simple narratives, benevolent billionaires are great. They have name recognition, they appear heroic, and they've got the cash. However, this pandemic has also shone a light on the other end of the economic spectrum, to the key worker. Delivery drivers, supermarket shelf stackers, nurses, carers. The pandemic momentarily upended the hierarchy of labour. And yet, in the UK, a set of proposed post-Brexit immigration controls in February deemed many of these exact essential workers too low paid and, quote, low skilled to receive a visa to work in the country.
I think that is at the heart of capitalist systems, that those who are deriving the most value from these economic systems are not the most essential workers, because what is keeping our economy going right now are the lowest paid workers who are really our most indispensable part of the workforce.
The workers in the healthcare system have seen the funds they've got to work with cut year upon year.
There are not enough people on this ward. There are not enough doctors, there are not enough nurses. It's not well organised enough. Right. The NHS has been destroyed.
And people who work in the social care system are often not earning enough to live on. What do we do with that knowledge? Because it wasn't just me and my wife who were going out and applauding the healthcare workers and our neighbours doing that. It was also the Prime Minister on Downing Street, who was part of the government that cut the resources that were going into the NHS, that starved the NHS of resources.
There's a term that's gained renewed currency during this pandemic: disaster capitalism. Canadian activist and author Naomi Klein came up with it years ago in her book The Shock Doctrine, and it went viral during the 2008 Great Recession. It points to how disasters, like a recession, a war, or a pandemic, aren't necessarily catastrophic across the board. In a capitalist system, they can also present an opportunity for the money-minded.
And we've seen a lot of profiteering during this current pandemic already. I don't think we've seen yet the limits of that profiteering, but we've got an early sense of which sectors and companies are starting to, for example, price gouge when it comes to basic health necessities like masks that are, for example, being charged at upwards of 15 times their usual cost.
Price gouging is one manifestation of disaster capitalism, and during this lockdown it's done everything from cause a temporary spike in the price of hand sanitizer to affect the number of ventilators available to the US government. According to a ProPublica investigation, in 2014, the US Department of Health and Human Services signed a $13.8 million contract with Dutch electronics conglomerate Philips to design and manufacture a cheap and portable ventilator for use in emergencies. Although a ventilator was created and the government ordered 10,000 of them, not a single one was ready at the start of the pandemic. Like many countries, the United States faced critical ventilator shortages, while Philips were selling 2 higher-priced commercial versions of the same ventilator around the world.
So they never fulfilled this order at the cheaper level for the Department of Health and Human Sciences. Instead, they prioritized the more expensive overseas orders. And it's only been recently that the Department of Health and Human Sciences has renegotiated the same order, but has been forced to pay for the ventilators at a higher price.
That renegotiation that Lindsay mentioned, it resulted in the US government ordering 43,000 of the commercial ventilators in April at 4 times the original price. In late August, the remainder of the order was cancelled only after a congressional committee raised questions about the expenditure.
But disaster capitalism can also be less direct and more obscured from public scrutiny, like who stands to benefit from some taxpayer-funded bailouts. Take the US airline industry, which had its request for a $50 billion bailout approved by the US Senate in March. While the loans were conditional on job protections, the sticking point for many is that over the past 5 years, the big four airline companies, American, Delta, Southwest and United, have not only made record profits, but collectively spent nearly the same amount, $45 billion, on stock buybacks and dividends, two ways in which companies can directly enrich their corporate executives and shareholders. So it's not that these bailouts aren't necessary now to avoid mass unemployment, it's that a substantial part of their current financial problem is arguably of their own making.
Billions of dollars were mobilized basically in an instant to bail out corporate America. And this is incredibly ironic because these corporations were in a weak financial place because of their own business models, because they had over-leveraged themselves, because they had engaged in pushing money out to shareholders instead of planning for tough times. Meanwhile, regular people are held to that standard. If you haven't saved, then it's your fault that you're suffering in this moment. So there's a double standard written into the economic response.
So you have a form of capitalism which does not live up to its billing. Because a real capitalist, red in tooth and claw, would say, well, capitalism works when the weakest companies go to the wall, when things that aren't working and bad ideas, they fail, and the people who support them, they fail too. Well, that clearly hasn't happened in any society under this pandemic. And that's probably a good thing. When we come out of this, I think we can certainly say that the old mantra of public bad, private good, that doesn't work. And I think we can also ask some questions about why is it the losses are socialised at times of crisis, and yet outside the crisis, the gains are always privatised. So we need to have a proper rethink of the kind of capitalism that we want coming out of this.
The efforts to rethink capitalism have been going on almost as long as capitalism itself has existed. And to be fair, it's practiced in notably different ways in different parts of the world. But one of the most toxic and recurring problems is that in too many cases, the system seems designed to favour a small, elite segment of the population. It's the idea we began with, that way before the crisis of this coronavirus, we were already grappling with the crisis of capitalism.
We hear this phrase, that we need to save the economy or we need to keep businesses going. It makes sense. But I think we have to ask a deeper question, which is, well, what's an economy for? Look at something like GDP, gross domestic product. All that means is that there's more affluence, but it has nothing to do with distribution. It has nothing to do with the quality of people's lives. You can have enormously high GDP and have, record rates of homelessness and unemployment. So we have to deconstruct this idea of the economy and put people at the center.
We are living in failed capitalist states at the moment, and that's been clear from the COVID crisis because the so-called wealthiest nations could not prepare their own companies or their own publics sufficiently to prevent avoidable deaths on a massive scale. Clearly, the wealth gains of the past sort of century have not been fairly shared. They've been hoarded by a few, while some people are left far more vulnerable by market processes than other people.
The stuff that is really important, that is really a priority, is not the stuff that we were told before. So it's clear that actually there is a merit for collective action, not individual action. It's also clear that there are some parts of the economy, some parts of society are just more important than others and shouldn't be taken for granted. Those are pretty basic things. You might call them the foundations of a civilised life, and they've been completely neglected in all of this attention that's being given to growth and to getting as much income into a country as possible without thinking too much about where that income went. I think we need to rethink the kind of capitalism we've got. I also think we need to rethink the kind of priorities we've got as a society now.